Hey, my name is Mackenzie Bird, and this is my medication administration video. So here is my ID, and my friend is going to be videoing me, and she's going to scan the room. Alright, so the first thing that I'm going to do is I'm going to make sure I'm in a no interruption zone. So I'm going to make sure that all the doors are closed. I'm also going to make sure that I am not taking any phone calls, and I am also going to make sure that I'm not conversing with my colleagues. The next thing that I'm going to do is I am going to check my patient care order form with my MAR, my medication administration record, and I'm going to check my drug and make sure that it is correct on the and that's my mark. So the next thing that I'm going to do is I'm going to make sure that my patient is the same, and I'm going to use two identifiers. I'm going to use their name, so Jaguar J. Jones, and then I'm also going to use their medical record number, 417-417-6352, and then I'm going to move to my drug. So I have Novolin R, regular insulin, U100, insulin, 10 units subcutaneously, 30 minutes before meals, 30 minutes before meals. Alright, so the next thing that I'm going to do is I'm going to do my first check of accuracy. So I'm going to start with my patient's name. So I have Jaguar J. Jones. I'm also going to check for allergies and penicillin. Then I'm going to move to my drug. So I have Novolin R, regular insulin, U100 insulin, and then my dose, which is 10 units, and then my route subcutaneously, and then my time 30 minutes before meals and 30 minutes before meals, and then my indication would be that my patient was about to eat. So the next thing that I'm going to do is I'm going to perform hand hygiene. And I'm going to get my drug, and I'm going to compare my drug to my medication administration record. So I have Novolin R, regular insulin, U100. Then I'm also going to be giving this drug subcutaneously every 30 minutes, and I'm going to be giving 30 minutes before meals, and then I'm also going to be giving 10 units of it. And then my expiration date is 12/1/2025, so that means it is still good to use. And here is my drug. The next thing that I'm going to do is I'm going to get my syringe, and I'm using an insulin syringe, and it is 29 gauge needle. And then after that, I'm going to calculate my medication dosage, and for insulin, it is already done, and it is 10 units. If it wasn't already done, I would then calculate. The next thing I'm going to do is I'm going to grab an alcohol prep pad, and I'm going to clean my insulin. And then I'm going to get my insulin syringe, and I'm going to get 10 units of here. Remove the cap. Inject it. And then I'm going to use the scoop method. And now I'm going to check a second time just to make sure. So I have Novolin R, regular insulin, U100, 10 units, and then I would be giving it subcutaneously, and here it is. The next thing that I'm going to do is I would check with a colleague to make sure that it is the right dose and the right medication. And then I'm going to do my second check for accuracy. So I'm going to compare Novolin R, regular insulin, U100, U100. That's my drug, and then my dose is going to be 10 units, my route subcutaneously. My time 30 minutes before meals, and then also my indication would be that my patient was about to eat. After that, I am going to also check the name, Jaguar J. Jones, and that's who I'd be giving it to. And then after that, I would put this and make my label. So I'm going to put the patient's name. The drug. And then the dose. And I'm going to pop this on my syringe. And then after that, I'm going to go to my patient's room with all my free things. And I'm going to knock on the door. And I'm going to introduce myself to my patient. So I would say, hey, my name is Mackenzie Bird, and I'm a student nurse here at South Alabama. And then I'm going to perform hand hygiene. And then I'm going to identify my patient using my two identifiers. So my first one is going to be their name. So I have Jaguar J. Jones, Jaguar J. Jones. And then I have my medical record number, so 417-417-6352-6352. And then I also would want to check for allergies, so penicillin and penicillin. And then I would also ask my patient if they had any other allergies that I would need to know about. After that, I'm going to do any pre-assessment tests that need to be done for my medication administration. And then I am going to do my third check for accuracy. So I'm going to compare. So I have Jaguar J. Jones, Novolin R, U100 is regular insulin. And then I have 10 units, and I'm going to be giving it subcutaneously in the abdomen. And then I'm giving it 30 minutes before meals, and then my indication would be that my patient was about to eat. The next thing that I'm going to do is I'm going to explain what I'm doing to my patient. With that, I'm going to tell them that I'm giving them 10 units of Novolin R, regular insulin, and then I would raise my bed to a comfortable working height, lowered my side rails, and make sure my patient was positioned where I could give them their insulin. The next thing that I'm going to do is I'm going to put on my goggles and my gloves. And I am going to inspect my patient's site. I'm going to be giving it subcutaneously in the abdomen. So I'm going to check to see that, I'm going to make sure that I'm giving it 2 inches around the umbilicus and make sure that I'm 2 inches away all the way around. Then I'm going to give it below my intercostal margins and then above my pubic region. Also, make sure to not go past my anterior superior iliac spine. And then I am going to be make sure that it's in a U shape, and also I'm going to check for bruising and poor skin integrity. After that, I am going to get an alcohol swab. and I'm going to clean my patient. It's and I'm going to make sure to do it in a circular motion, not going over what I've already done. And then I'm going to leave my pad like that, but it's not going to stay because, yeah. But I would be facing towards the, where I just cleaned so that I would know where to get the injection. The next thing that I'm going to do is I'm going to get my injection, and I am going to take off the cap. And I am going to be giving it subcutaneously in the abdomen. So I'm going to make sure that I can pinch 2 inches of skin so I can give it at a 90-degree angle. If I couldn't pinch 2 inches of skin, I'd just do 1 inch and do it at a 45-degree angle. But I can pinch 2 inches right now, so I'm going to be giving it at a 90-degree. And then I'm going to place that and put that in the Charlotte container. The next thing that I'm going to do is I'm going to lower my patient's bed, get them back in a comfortable position, and raise my side rails. I am then going to remove my gloves and my goggles and perform hand hygiene. Then I'm going to assess my patient's where I put the injection site, and then I am going to check to see their reaction and if there's any reactions going on. And then I'm also going to document the reactions, the 7 rights, and the time the dose was given in their MAR. And after that, I am going to make sure to go back and check on my patient later and see if how they are tolerating the drug, and also if they are having any allergic reactions. Thank you.